Hello and welcome to today's session, which is on disorders of the body systems. I am Dr. Rachna Agarwal, Assistant Professor at School of Vocational Education and Training, Indira Gandhi National Open University. So let us begin today's session, which is on disorders of the body systems. Let us see what all we are going to cover in today's session. We will be describing the various disorders of some of the body systems, as it is not possible to cover all the diseases and disorders of entire body systems. So I have shortlisted today 3 areas, that is cardiovascular system, digestive system and nervous system. If we have time, we can also touch upon endocrine system. Otherwise, I will take it up in the next session. So let us begin today and see what are the various disorders of the cardiovascular system. Cardiovascular system, as you all know, consists of heart, the blood circulatory system and the blood vessels. Some of the common disorders which are very common and we all have heard about is a heart failure or a cardiac arrest. But there are many other disorders which relate to the cardiovascular system. Let us take them up one by one and see what are the various disorders. First is hypertension or high blood pressure, hypotension or low blood pressure, myocardial infarction, angina pectoris, arteriosclerosis, congestive heart failure and arrhythmias. We will see in detail what does it mean by each one of them. Hypertension or high blood pressure, we all have heard of and we must have seen in our homes also. Some people suffer from either high BP problem, which we say. What is hypertension? What is high blood pressure? Hypertension is actually a chronic condition which is characterized by increase in the systolic blood pressure when it goes above 140 millimeters of mercury, and diastolic blood pressure when it goes over 90 millimeters of mercury. If I have to explain systolic and diastolic, if you recollect, the structure of heart is, our heart consists of 4 chambers. Upper 2 left and right atria and lower left and right ventricles. When the heart pumps blood, what happens? The upper 2 chambers, which are the left and the right atria, they contract. When there is a contraction, the blood moves out, and just after the contraction of the atria, the lower 2 chambers, which are the left and right ventricles, they also contract separately and they also release or empty the chamber and the blood flows out. This contraction is actually which we call as systole. So systole is the contraction of the chambers and moving out of the blood from the heart to the various parts of the body. When the muscle, all the 4 chambers relax, that is, the contraction gives away and the heart again gets filled up with the blood, it is known as diastole. So diastole is a relaxed state of the heart and systole is a contracted state of the heart. So when this the pressure, heart is pumping your blood, so when the pressure is increased to more than 140 millimeters of mercury in the systolic blood pressure and more than 90 millimeters of mercury in the diastolic blood pressure, we say that a person is suffering from hypertension or high blood pressure. And what is the normal BP? Normal BP ranges from 120 upper to systolic and 80 diastolic millimeters of mercury. So in anybody who is having near about 10-20 millimeters of mercury of variation is considered okay, but if it is more and it remains more throughout in most of the times in a person, then a person is said to be suffering from hypertension or high blood pressure. Next, we have another condition of cardiovascular system or a disorder, which is hypotension. Hypotension is low blood pressure. What happens in hypotension is, consistently there is low blood pressure due to the fall in the diastolic blood pressure. That is when the systolic blood pressure is less than 100 millimeters of mercury. Normal range is 120. When it is less than 100 millimeters of mercury and the diastolic is less than 60 millimeters of mercury, and it is generally seen in patients who are anemic, or they have a frail body, they have a weak system, or if there has been an accidental case where there has been excessive loss of blood. In such cases, we say that a person is showing hypotension or low blood pressure. Okay, now coming to other disorders of the cardiovascular system, we have myocardial infarction. See, myocardial infarction is ischemic necrosis. Necrosis is the death of the cells, premature death of the cells, as we say, and tissues. When this happens in the myocardium of the heart, that is, myocardium is the middle layer of the heart. Heart is a muscular organ, and its action is pumping blood. So there are various layers, and when there is premature, unexpected death of the living tissues or cells of this middle layer of the heart, this condition is known as myocardial infarction. And naturally, when the muscle gets weak, the heart will get weak, and the ability to pump blood will not be as good as in a healthy heart. So, this is a condition which is also shown in some persons, and it generally results from an abrupt abrupt reduction in the blood flow to a particular, say, region of the heart, right? So it may be because of other reasons. The reasons may be unknown, but as I explained, it is the middle layer of the heart. When the cells unexpectedly, prematurely start dying, then this kind of condition arises. Next disorder of the heart is angina pectoris. Angina pectoris is a pain related syndrome. That is, it is associated with the myocardial ischemia, as we said, that in which there is partial obstruction of blood flow in the coronary arteries of the heart, and one experiences, due to this obstruction, one experiences a severe pain. As we know that sometimes we must have heard of some people who have experienced a heart attack condition. What happens, they experience severe pain in the chest, and they experience this pain radiating in the arm, left side of the arm, and also sometimes going up till the neck. So this is a condition wherein there is extreme severe pain of the chest due to obstruction of blood flow to the heart, in the heart. So this condition may be due to either a stress condition, or it may arise because of exertion. That is, if you do too much of hard work, exercise, all of a sudden, if you one day plan to run a marathon, but your body is not used to running, or the body is not used to that much of exertion, but you start exerting the body, then the heart will not be, heart is out of practice. It is a pump, the muscle has to be in practice of. That is why we say we should do cardio. Cardio means what? An exercise on a daily basis, either brisk walking, running on a daily basis for 25 to 30 minutes. This will keep your heart muscles active, and sudden shock or collapse will not lead to any heart problems. So, this condition, angina pectoris, arises when the heart muscle is weak and there is a severe pain in the chest, in which the pain also radiates up till the left arm, elbow, cheek, chin, and neck. So let us see another disorders of the cardiovascular system, which is arteriosclerosis. Now, in this disorder, what happens is that there is narrowing of the lumen of the arteries. Arteries are the ones which are supplying blood to the heart. When these arteries get blocked, clogged due to some deposition, or due to obstruction, as we mostly, the common name is cholesterol deposition, bad cholesterol. So what happens is there is narrowing of the lumen of the arteries, and also at times the elasticity, which we say that the ability of the arteries to contract and move is sometimes also lost. They become rigid, hard. Just imagine, a tube or a pipe. You must have seen a rubber hose wherein the water flows. Sometimes if you just leave it out in the sun, what happens? It becomes brittle, hardening, it will crack. Similarly, we have elastic tubes like arteries in our system, which because of various reasons can become either hard, or they can have some deposits in the interior lumen of the arteries. So when there is deposition, what happens is that there is thickening of the lumen of the arteries. Like, because of the deposition, the diameter of the arteries narrows down. So when this narrowing of the lumen takes place, the blood flow is hampered. So when the blood flow is hampered, naturally then the supply of blood from the artery to the heart is also hampered. But when you are doing some exercise, the heart is pumping fast, it requires more blood, it requires more oxygenated blood, but the arteries are not able to supply with the same rate at which the heart is beating. So this condition can also lead to a heart problem or a heart failure at times. So arteriosclerosis is a condition wherein the plaques form in the blood vessels due to fatty deposition, which is termed as atherosclerosis also. Next condition of cardiovascular system or disorder is congestive heart failure. Now, in congestive heart failure, it is characterized by a decreased blood flow to various organs of the body due to failure of the pumping action of the heart. Now, I have already explained there have been various conditions wherein either the muscle of the heart gets weakened, or the flow of blood to the heart gets hampered, and as a result the heart is not able to function at the same pace at which the body requires the blood. So when these either the narrowing of the arteries lumen or the weakness of the heart muscles, all these factors can lead to a condition which is known as heart failure, which is a congestive heart failure. And as a result, there is congestion, that is, there is fluid accumulation in the pulmonary and systemic systems of the body circuit, which leads to edema or swelling of the various organs. Next condition or disorder of the cardiovascular system is arrhythmia. Arrhythmia or dysarrhythmia, we can say, is a term which refers to irregularity in the heartbeat rhythm, and herein there is a defect in the electrical conduction system of the heart. The normal heart rate is around 70 to 80 beats per minute, But under some conditions, heart rate may either increase or it may decrease. Increase when either you are climbing a hill or doing some trekking work or doing some physical labor, running, exerting your body, exercising. Then in such conditions, the heart rate should not go beyond a certain um, range, like 70 to 80 or maybe 85. But if it goes beyond 90 or something, 90 beats per minute or 100 beats per minute, then that is not right. There is something wrong, and we say that the rhythm of the heart gets affected. So any increase, or for that matter even decrease, say when you are in a resting condition, it should not decrease beyond a point. Okay, so any increase or decrease in the rhythm of the heart is causes a condition of the heart which is known as arrhythmia. So these were the disorders of the cardiovascular system. In digestive system, you would recall it comprises of one is it is a continuous tubular system which starts from mouth ranging to anus, and in between you have pharynx, esophagus, stomach, small intestines and large intestines. So the accessory digestive organs are those which help or aid the process of digestion. These are our salivary glands, because saliva is helps in breaking down starch, and the digestion first starts in the mouth. Then teeth and tongue, which are very important for chewing the food. Then we have liver, which is very important for production of bile, gallbladder and pancreas. So these are all the accessory digestive organs which are very important. Now the medical specialty that deals with the study of structure, function, diagnosis and treatment of diseases of the stomach and intestines is called gastroenterology, and the medical field that deals with the diagnosis, treatment and disorders of the rectum and anus is called proctology. So now let us quickly see what are the common disorders of this system. First is constipation. Constipation is a common term we all have heard of. Constipation is a condition which is characterized by infrequent or difficult defecation, and this happens because of decreased motility or the movement of the intestines. As you know, the feces which have to be defecated, if they remain in the colon for a longer time or for a prolonged period, then excess water is absorbed by the intestines from the stool, and it becomes dry and hard, and as a result it is very difficult to defecate. So the constipation may arise because of various reasons, that is when we take less water or less fiber in the diet, or it may be because of some age related problems or medication, if you are having too many antibiotics, if you are on some medications, or maybe because of some psychological conditions. Now second disorder of the GI or the digestive system is diarrhea. Increased frequency of the passage of stool is there, and it also causes an increase in the volume and fluid content of the feces. Now diarrhea can be because of some infection, some bacterial infection, and or it may be because of some poor digestion, or some problems with the intestines. When the intestines are not functioning properly, they are not able to absorb the right amount of water from or the fluid from the food which we eat, then also it is passed as a loose stool. Gastric mortality, in which may be due to the infections or gastric irritation or some allergies which one is susceptible to. So, acute or severe diarrhea can also be a common cause of death in many areas of a developing country like India, and especially in small children, wherein the system is not that strong to withstand the loss of fluid, because any diarrheal condition will lead to loss of fluids from the body. So it is important to maintain the right amount of fluids in the body. Another condition is nausea and vomiting. We all know that nausea is a feeling of wherein we want to throw up the undigested food because of various reasons, either again an infection or maybe because of some say obnoxious smell or some other condition wherein the vomiting reflex sets in and there is expulsion of gastric contents from the upper gastrointestinal tract through the oral cavity, that is the mouth. Now, next important condition of disorder of digestive system is the gastritis. Gastritis can be an acute or chronic inflammation of the gastric mucosa, and this is a membrane which protects our system because there is a lot of acid in the stomach. Okay, and anything which we even eat sometimes spices, but of the linings of the stomach are having this mucous membrane which protects our system from the harmful or the burning or irritation of these or the attack of any infectious organisms. So it is important that we maintain a healthy mucosal lining of the gut. Next, a condition which is common, not that common, but yes, it is common in many cases we have seen is peptic ulcer. Now, peptic ulcer is characterized by some formation of lesions or ulceration, which we say in the gastric or the duodenal mucosa, that is the lining of the stomach or the GI tract. Ulcer is like a crater lesion, gastric juices. Now, peptic ulcer is when it gets worse, it can even lead to bleeding, and it can also go to the extent of causing anemia because of excessive loss of blood. Helicobacter pylori, we also do the test sometimes to find out whether the person is having any infection of this bacteria, or it may be because of some extra gastric acid secretions in the body or consumption of any irritant substance which damages the mucosal lining of the stomach. Next condition of disorder of digestive system is hemorrhoids. Hemorrhoids are commonly known as piles, and this condition is characterized by the presence of dilated veins, varicose veins around the rectum or the anus, and it can also lead to loss of blood. Now, there are two more systems, that is the nervous and the endocrine system. I think we can take it up in the next session because nervous system is little in detail and there are a lot of disorders. So, if I just happen to touch upon, I will rather touch upon the disorders of the endocrine system. Endocrine system, we know that there are certain parts of the system which stimulate or inhibit the release of hormones in the body, and endocrine system is all about these organs or the glands which release hormones. And in return, this when the endocrine system disorders happen, the level of these hormones may be either very high or it may be inhibited. That is, it may either become hypo or it may be hyper. The secretion of the hormones may be in too much excess, then we say this is a hyper secretory problems arise, or it may be less secretion and we say that there is hypoactivity or the reduced activity of these glands. So, the endocrine system helps to regulate the activity of the glands as well as these cardiac and the smooth muscles, and it also affects most of the tissues. So, endocrine system governs the disorders of our glands, and in our next session, I will be discussing what are the various disorders of the these glands like anterior pituitary, thyroid, adrenal, and pancreas. So let us sum up, and today we have been able to cover in this session two major systems, which is cardiovascular and GI, or the digestive system, gastrointestinal system. We have studied about the various disorders of the cardiovascular system, what is high blood pressure or hypertension, what is hypo or low blood pressure, what is myocardial infarction, angina pectoris, what is congestive heart failure, and what are the problems with the arrhythmias, that is the problems with the rhythm of the heartbeat. So these are the disorders, these were the disorders of the cardiovascular system, and also we have dealt with the disorders of the digestive system, like some common disorders like what is constipation, what is gastritis, how do diarrhea affect in our body, what are hemorrhoids, what are peptic ulcers. And in the next session I will take up the various disorders of the nervous system. You must have heard of, which is also very important, like schizophrenia, what is Alzheimer's, what is convulsion, epilepsy. This all we will cover in the next session. So this is all for today's session. Thank you.